Deputy President David Mabuza, in his capacity as chairperson of the SA National AIDS Council, is this morning leading a government program to commemorate World AIDS Day. That's happening in Bloemfontein. Health experts have warned officials not to lose sight in their fight against HIV and AIDS, as the focus seems to have shifted to the COVID-19 pandemic. Newzroom Afrika's Tumaole Mohlaoli is in Bloemfontein for us this morning, ahead of the gathering there. Tumaole, this gathering, of course, important as it is happening on the back of this incredibly important development yesterday with the handing over of that Section 89 independent panel report insofar as the President's involvement in his Phala Phala farm robbery is concerned. It goes to show that there are huge issues that we're dealing with in our country on a daily basis, and HIV and AIDS certainly can't take a backseat.
Indeed, Michelle, certainly can't take a backseat, because the story of HIV and AIDS in South Africa has really been one of gradual, hard-won success. One can only think back to the not-so-distant past when you look up at it historically, to Nkosi Johnson, who became the face of the fight against the HIV-AIDS pandemic in South Africa. Our government has gone through many different strategies to try and fight this particular scourge, with South Africa having one of the highest, of course, infection rates in Africa, if not the world. Many critics have argued that South Africa statistics stand where they are because other countries simply don't have the capacity, especially in the continent, to try and record those statistics. So when you look at the statement that was released by the World Health Organization on World AIDS Day, HIV remains a major public health issue and affects more than 2 million people in the WHO European region. That's a European perspective, and we know that, of course, in the European region, the health systems are far more advanced than many here in the African continent, and that's really one of the issues that is driving the messaging of the World AIDS Day event here in Mangaung, and across the country, other events as well. Activists will be taking the floor, going to community members and urging them not to submit to what is being classed as HIV/AIDS fatigue. Many activists as well as healthcare professionals are concerned that there seems to be almost desensitization after what was a very important intervention with government drumming the message of course, prevention as well as cure in terms of taking the ARV treatments for those who find themselves affected and infected by the HIV/AIDS pandemic. Young people seem to be the target market. Young people are the ones that are being appealed to try and not succumb to HIV/AIDS fatigue, because once you kill it at the root with the young people, then the figures will go down. So that seems to be the strategy there, Michelle.
Important that you're giving us that perspective from European nations, Tumaole, because really the figures in South Africa put those numbers to shame, for lack of a better term. 8.8 million people is the estimate living with HIV and AIDS here in South Africa. We're still the country with the highest prevalence of this disease around the world. So with that in mind, one wonders how the message from the Deputy President today is going to be different.
Well, I think consistency has really been the key and really been the strategy that has been applied both by provincial, local, as well as national government when it comes to the issue of fighting the HIV/AIDS pandemic. There are messages all over government buildings which certainly promote prevention as being better than cure, saying that people, although are having access to ARVs through various government initiatives, including with partnerships with partners, including the American government, who then provide those much-needed medications to those who are affected by the pandemic, prolonging their lives and improving their health, allowing them to be active and very involved and contributing to their communities. So this message is going to be basically reverbed again, particularly aimed at young people. What government, especially the health department and the World Health Organization, Michelle, are concerned about is the fact that apart from the so-called HIV/AIDS fatigue, there's also the issue of risky behavior, whereby people indulge in, alcohol, people go out and indulge in risky behavior like unprotected sex, and this is something that needs to be drummed back to encourage people to take care of their health. Also, the issue of screening and testing. I think these are the messages that will come to the fore today.
Yeah, certainly. And you'll give us up to speed as those discussions take place. Tumaole Mohlaoli, live to us there in Bloemfontein, where that event is taking place.